Welcome to another edition of the National Athletic Healthcare Association podcast.
Welcome to a program at the National Athletic Healthcare Association. Today, we are here with Corene Hurt-Thaut. If you want to introduce yourself, give a little bit about your background, and so impressed, and thank you so much. We're here today to talk about music therapy.
Thank you, Sean, for having me. Do you want me to tell you a little bit about myself, my background?
Yeah.
Yeah, so my training was initially in music therapy many years ago, and I realized as I started working as a therapist that I wanted to know and understand more about what music was actually doing to the brain when I was working with people. And so I went back to school and studied music and neuroscience, and really focused my efforts in the area of neurologic rehabilitation and neurologic music therapy, and looking at really understanding more how can music perception, music cognition, music production actually engage the brain and change the brain by engaging the brain. Then, of course, I wasn't smart enough yet, so I went on and did my PhD as well, and because I wanted to understand better how to research this and be able to better translate those findings to the people who need it most, which is our patients.
And that's a tremendous point. And we were talking a little bit before the recording about myself. I'm a neurologist, and I kind of delve into multiple areas of different neurology, yet none of them discussed music therapy. In fact, what's frustrating for me is that a lot of programs that are out there and available for patients and resources for families really aren't discussed at all as far as neurologists, and we have very little knowledge within our own programming source for extra additive resources that may have some really strong background in science on how they developed and how they can really help and affect people. So really tell me, I guess, what kind of patients do you feel are most adapted or best able to be helped from music therapy?
Yeah, so I'll respond like a little bit to your statement that you just made about neurologists not being aware of it.
Yeah.
I think one of the things that may have influenced that is that music therapy has traditionally kind of been operated kind of on a social science model, and really looking at wellness and well-being, and implementing it a lot with psychosocial type goals, and a lot of psychiatric populations. And my interest has really been more in looking at very functional, like more like neurorehabilitation types of issues, and how music can be used in those areas. And so I think that that's where neurologists kind of perk up with their ears, because that's how they think. They think about the brain, and how can music, if music's going to be interesting to me, what can it do to help my patients get better? That said, I don't really think about it in terms of being population based, but I think about it in terms of function based. And I'm not sure if this is going to be just an audio or a visual as well, but
Both, yeah.
can I just share a slide? I'm not sure.
Absolutely, please. Oh, that's tremendous.
So I think that when we are thinking about music, it's important to think about all the parallels between things that are happening in our brain when we engage in a musical task, and things we just do in our everyday life non-musically. So for instance, when you play music, or when you listen to music, or when you're often learning something and you want to memorize it, you use music. So there are all these things like memory, attention, motor control, emotions, perception, executive function. All of these things can be very present in music. And so instead of thinking, like I said, about populations, I think about the person that I'm working with and what are their needs. And so it doesn't matter if they have a psychiatric disorder, if they have a diagnosis, have experienced a traumatic brain injury, or whether they're just a child who's learning how to attend in the classroom. We know that music can be used for attention. And so then I would design my exercises based on my knowledge about music and how it can influence attention. And so I think one of the things that people often get a little bit confused about is when we say neurologic music therapy, we're not just referring to the typical stroke or Parkinson's or traumatic brain injury, but we're referring to the brain and how music can influence the brain.
I think, even in the progress of from, growing up as a child to adult, really our ability to incorporate music in with the growth of any individual is incredibly important. We could, talk, a long time on this, for sure. When we have individuals that are either, I kind of separate my patients in the sense in these types of situations into kind of static conditions, things maybe that are congenital that people are born with, such as autism, versus those that have acquired conditions such as, traumatic brain injury or maybe a neurodegenerative condition. Do you work with patients on all types of realms?
I do. I work with patients who have rehabilitative goals, so more, stroke, brain injury, but also developmental goals. And so you may be working with someone on the autism spectrum or someone maybe who just has developmental delays, maybe ADHD or something like that. And then also with adaptive types of goals for maybe someone with Parkinson's or dementia, that our goal is not to make them better, because we're not going to be able to do that, but how can we help them function at the best possible level for as long as possible. So
Absolutely.
yeah.
So some kind of basic questions. So I know, I'd love, in a future program, maybe to get into the neuroscience of it. I think that that's really important to recognize that music actually alters brain function, and it's not simply an ancillary feel-good process or program that makes us feel better. It releases dopamine, it hits those neurotransmitters, but it connects all parts of the brain. Correct me if I'm wrong. Unlike any other language source, when we talk about just speech and language, we think primarily, although we're learning a lot more about that left-sided brain process, that most people use the left side of the brain. Unlike that, music and song and intonation really involves the entire brain, and it's phenomenal on its incorporation. Because some of my own patients, especially like my Parkinson's and Alzheimer's, they may forget language as far as speaking and writing, but they can always sing as a last advent, and I think that that's absolutely tremendous. So I do try to incorporate that a little bit. I want to kind of use a case example, if that's okay, and guidance, and I think that it kind of expresses a lot more. Introducing Todd here. And Todd, and if you don't mind, just give a 5-second overview of your family situation.
Sure. Yeah, my daughter's 23 years old. She was involved in a horse accident at work, and she has a traumatic brain injury. The left side of her brain was injured. So we're working on her speech right now. They said she has a condition it's called aphasia, where she, she has some sentences and things are coming back to her, but it's really weak. But we've used song and singing, and that kind of helps. Her voice becomes a lot stronger when she sings like a song that her mom always sang to her, like "You Are My Sunshine," and it kind of helps her verbalize a lot better. But
Now, Corene, if you don't mind me, I'm going to translate this a little bit in the sense of how could somebody like Todd and his family use music therapy? Is it more than just singing songs that people like and know?
Yeah, very much so. So, with your daughter, for instance, just from the bit of information that you gave me, we have a technique called melodic intonation therapy. And the idea is that a lot of times when people do have aphasia after a brain injury, they still maintain this ability to sing, because singing uses, as you know, more of the right hemisphere, And also that melodic component of our speech is more of a right hemisphere function versus the actual acquisition of the language is more of a left hemisphere function, or Broca's area. And so we see that instead of maybe singing "You Are My Sunshine," if we were to put things that you want her to be able to say, like "I'm hungry," or "I'd like to go outside," or "Let's go to the movies," or whatever it might be that would help her communicate in her everyday life, we would put that into a musical phrase, and we would practice it through this stepwise process that was invented by speech therapists back in the early 70s, really, but it works quite effectively. And I have wonderful videos I could show you of it in process, actually. And then she's not only singing, which is, it's lovely to be able to sing songs that she enjoyed, but maybe she can sing "I love you," or
Right.
"Mom, I'm hungry," or "My name is whatever." And so that's really the idea of how the process works.
It's really interesting. Yeah.
Corene, is just out of curiosity. So let's say that unfortunately that, we have a loved one with a traumatic brain injury. Is it important to bring in songs that, like, for instance, if I grew up on country music or rap, do we have to bring in those genres of music, or is there a particular, do I have to listen to Bach and Mozart and classical music? Like how do we reshape the brain? What is the best methodology of introducing music therapy for a particular person in that setting?
Yeah. So I have to always clarify that I'm talking about neurologic music therapy,
Yep.
because a music therapist may heavily disagree with things that I say. So as a neurologic music therapist, I would look at what I know about the elements of music and how they drive change. So in this case, I know that for someone with aphasia, the melody is extremely important and the rhythmic component is extremely important. And so I would have somebody who I was doing melodic intonation therapy with tapping their hand in order to activate that motor area that's close to the speech area that we're trying to prime to speak. So I'm always thinking about how is the music driving the change, and what is it in the music. And it's most often not because it's their favorite song or the genre that they like. It's most often something like the rhythm or the melody or the harmonies, or maybe a combination of those to drive maybe movement or a cognitive process. And so really thinking about music much more intricately, about like the different elements of it and how each of those can drive a certain cognitive or motor or speech and language function.
I think what's really interesting is, kind of researching, watching some videos about, having EEG leads, which EEGs are just basically measuring brainwave patterns, and just simply playing different musical therapies without somebody talking or reacting necessarily to it. Our vital signs change. We have an emotional response to that music, and it can often be very calming or engaging for individuals, but also like discorded music, music that's a little bit more, maybe not, as fluent, can cause some abnormal brain waves, things that we may not want. So I think, I don't know, my guess is that specific genres, and correct me if I'm wrong, may be more palatable or able to help individuals than some others. For instance, if I played AC/DC, maybe it's not as agreeable. I don't know.
Depends on the situation and what your goal is with the music. Are you just playing it because they need a break and they need to listen to music that makes them relax and that they enjoy? Then AC/DC might be the music that they would choose. If I was trying to work on their gait and mobility, and I wanted to use a technique we call rhythmic auditory stimulation, where we match the rhythm to the cadence of their movement, and I'm working with someone who had a traumatic brain injury, and I put on AC/DC, I'm going to throw them over the edge probably with the amount of stimulus that I'm putting into them. So it really is based on the client, the diagnostics, what my functional goal is, and then I decide, do I need right now to choose a piece of music that's really important to them and that they have a maybe more psychosocial kind of response to, or do I need to choose music that's going to help them speak better in this moment because that's what they want to be able to do.
Now, based on that, do you work with physical therapists who are also knowledgeable and experts in the music therapy world, or at least trying to transition that, not just only their brainwave kind of impressions, but into a movement and activity process?
Yeah, absolutely. A lot of the research that we've done, a main member of our team is a physical therapist. And in the clinical work I've done, I've worked very frequently with physical therapists. I bring in the musical knowledge and the understanding of how music can influence movement. And they bring in the perspective of really understanding the body and the kinematics and what needs to happen. And then I can add that musical aspect and knowledge. So it's a really great partnership. We do have a technique, rhythmic auditory stimulation, that's specifically for gait, and it's taught in PT school. I mean, PTs learn this. I've spoken at the American Physical Therapy Association conferences several times. So it's something that's very much used and identified as one of the top interventions for Parkinson's, for stroke, for some neurologic populations.
Yet I'm not sure that it's used in our rehab centers, as maybe much as what it should. And I could absolutely now see that benefit when I go to these. Sometimes it's a little bit challenging. It's kind of a quiet, static area, and you're motivating by voice, but I bet you playing somebody's favorite song or working with them is going to help them motivate a lot better, especially if we incorporate that with individuals that have a lot of great knowledge behind it and everything like that.
But if I want them to walk better, I guarantee you if I put a metronome on, it's going to work better than playing their favorite song.
Great.
I guarantee that.
Do we have, so in individuals, we now have kind of imaging sources called what we call functional MRI. So when I do an MRI, or what I call a picture of the brain, I always tell people, listen, this is a single picture in time. I can't tell if somebody's happy, sad, smart, not smart, or how that picture looks, unless there's a large structural defect or a change, which there isn't most of the time. We now have some imaging techniques, some SPECT scans, some functional MRI, and other things to kind of show some blood flow patterns through that. Is there a lot of work on music therapy and how that may affect or influence different functional changes in the brain?
Yeah, again, I'll say music therapy is such a general term. I can't really say
Neurological
that.
music therapy, yeah.
Yeah, and not even neurologic music therapy, but really looking at specific functions and aspects of music. And there's lots of research looking specifically at, for instance, what's happening in the brain when someone is processing rhythm, or when someone is doing a rhythmic entrainment kind of task versus a speech and language task. What's happening in the brain when someone is actually engaging in melodic intonation therapy. So yeah, there's a lot of research in this area, but it's very specific about what the intervention is, and not music therapy necessarily.
Got it.
Yeah,
Yeah,
that's such a
absolutely.
general term that it's really hard to relate that to a specific outcome.
I'm going to ask a couple. So for Todd and in his situation, Todd, where do you live, may I ask?
Where do I live?
Yeah.
In Minot, North Dakota.
In Minot, North Dakota. So
Yeah.
Todd may not have the resources, or I'm not sure if there is a music therapist. There may be in his area. Correct me if I'm wrong, Corene. There's about 8,000 certified music therapists in the United States. Is that about correct?
Mm-hmm. I
And
think, yeah, around 9,000. I think around 9,000
about 9,000
board certified. Mm-hmm.
board certified. I mean, I guess other than just Googling, is there a resource that Todd can go to maybe find somebody in his area that might work best for him?
Yeah. So I would highly recommend, again, a neurologic music therapist, someone who's been trained specifically to work with traumatic brain injury, for instance. And we have the Academy of Neurologic Music Therapy, where we've trained over 5,000 therapists in these evidence-based interventions. And we have a registry on our website, so you can look for an NMT in your area. But, one of the positive things about COVID is that we've learned just how successful teletherapy can be. And I'm currently, and my students and many professionals that I've trained are working with people all over the world. Even if they're sitting in their home in Boston, they may be working with a client who's in South Dakota or North Dakota or California or wherever it might be. So that's really the neat thing about Zoom, for instance.
Yeah, absolutely. Like our conversation. Certainly, we've all learned to adjust to that for sure, and maybe adapt a little bit more. I think that what's important is providing resources for patients, individuals, and such like that that might, help families out the best as possible. And myself as a neurologist, I can't tell you that I know any neurological music therapists. And now, guess what I'm going to do? I'm going to learn who my local resources might be. Is it paid for by insurance at all, or is it all cash out of pocket?
It is often paid for by insurance. We have a whole coding manual for the standardized techniques in NMT, and they're all lined up with CPT codes that are standardly used with, people think that they're claimed, oh, that's an OT code or that's a PT code, but they're really function based. And so
Yeah.
we've lined the research and the techniques up with the
I
intervention.
think I know that I'm going to take a more concerted effort with trying to make sure that I match individuals up with some music therapists in my area. I try to bring resources to our partners, and this is certainly one of them that I definitely would recommend. Absolutely now and in the future.
Yeah.
The so I guess I should ask Todd. As far as I guess your daughter goes, uh, was she musical before? Did she play instruments?
Not no, but she, like everybody her age, listened to a lot of music, had a lot of different playlists, and
Right.
while she worked riding horse, she would listen to music all day long.
Sure. Corinne, does it matter if somebody into their response rate of this, did they have to play an instrument before? Or is it all equal, or does it make a difference?
Yeah, so it's really all equal. We probably most of the people we work with don't have any formalized or significant formalized training in music, and so it's really not based on your musical ability. It's based on what we know about what music can do to any brain.
Yeah, absolutely.
Yeah.
Yeah, and I definitely know I don't want to keep you too long here. You've given us some great information and resource for starting. I hope that in the future you'd be willing to come back, give us some more information, give us a lot of guidance on maybe some patient specific. We'd love to see some case studies. And I know that our population, my patients and individuals that come to our site are going to have a lot of questions in the future that I won't be able to answer. And so hopefully we can give them a local resource for them to kind of turn to. Todd, do you have any questions that you may want to ask at all? Or
I can't really think of anything offhand at the
yeah,
moment, I guess. I know they talked about doing some music therapy here. We're currently at Craig Hospital in Englewood, Colorado, but we haven't really seen much about that yet. So, but we're hoping to.
There's a very active group of neurologic music therapists who've created who do a lot of NMT actually at Craig.
Okay,
and I've done many
good.
presentations there as well. So they are knowledgeable about NMT.
Okay,
So definitely
that's good to hear.
something to ask about.
Right.
Yeah, and I'm also happy to, if you wanted to send an email or anything, I'm happy to answer any questions or connect you with somebody. If you're in Englewood, I can connect you to someone in the area.
Okay, I would appreciate that.
Yeah, absolutely.
well, thank you so much for your time. We look forward to speaking with you in the future for sure. We're learning new and different aspects of helping each other kind of work through not only just being smarter and healthier, but when we do have some injuries to ourselves or families, to try to help heal those the best we can. So much appreciated and invaluable information. Thank you.